Hello, and welcome to the University of Chicago. I'm Emily Landon. I'm an infectious diseases specialist and the hospital epidemiologist for the medical center. As you know, people have already tested positive, and many of you have tested negative. Which brings me to your current stay-at-home and quarantine orders. I know it's a total bummer to arrive at college and be stuck in your room, especially when you don't know anyone. First of all, this isn't a punishment. It's an intervention that can really make a difference. You are smart and committed students, and you deserve to understand why we're asking so much of you. And that's why I wanted to talk to you today. It's time for a little primer on epidemiology. COVID is spread when someone who's contagious has close contact with someone who is susceptible. This statement is super simple, but embedded in it is the key to preventing outbreaks. Not every close contact will result in COVID being spread from the contagious person to the susceptible one. And our main goal with everything in the entire COVID response plan is designed to reduce the likelihood of a successful transmission. We have 3 tools we can work with. 1, decreasing the number of contagious people available to have interactions. 2, minimizing the likelihood of a successful transmission on the part of the virus. And 3, reduce the number of susceptible people available to catch COVID. Now, I just want to take number 3 off the table from the start. This is the argument for herd immunity, and it would make for way too many high-risk encounters for those much more vulnerable than many of you. But once we have an available, safe, and effective vaccine, we will absolutely offer it to reduce the number of susceptible people. In the meantime, we have the first 2 methods. So, number 1, decreasing the contagious people available to interact with the susceptibles. This seems like it would be easy. We just keep the sick people away from the healthy ones. And it is easy for when people develop symptoms. But COVID has a major advantage over us on this front. You can't tell who has it. You can't even tell if you have it. See, even people who get symptoms are contagious long before the symptoms start. And the younger you are, the more likely your infection is going to be asymptomatic from start to finish. So removing contagious people from the community based on symptoms is impossible. So we're testing all of you in housing on a regular basis. Incidentally, students who live in dorms and test positive will be moved into the isolation housing, removing them from the community. This may be a little anxiety-provoking, but please don't worry. Isolation housing is just a safe place to be while you're contagious. The university is taking care of transportation, your basic needs, and student wellness will check in on you regularly. Just be sure to pack up everything you'll need to be comfortable and take your classes, if you feel up to it, for about 10 days. Being in isolation is not a punishment because no one deserves to get COVID. Which brings me to number 2. We need to minimize those successful, on the part of the virus, COVID transmissions between people. Obviously, masking and distance are the mainstays of this, but so are ventilation and avoiding crowds. There's another aspect that we sometimes underestimate, because every one of us has and needs to have up-close and unmasked contacts. In fact, and this might be a surprise, we want you to have at least a few people that you see and spend time with up close and personal, so to speak. Just not yet. All of you have come from different families, different places, and have had different up close and unmasked contacts with different risks in the weeks leading up to arriving here. Then you traveled and moved in, which undoubtedly added more people to your up close contacts list. That negative test you had when you arrived doesn't mean you didn't catch COVID before you got here. It just means you didn't have it on move-in day. Think about how many people you've been around within 6 feet for 15 minutes or more in the last 10 to 14 days, even if you were wearing a mask. If you developed COVID today, all those people would count as close contacts, and all of them would be at least medium risk for getting COVID too. The more close contacts you have, the more opportunities COVID has to spread. See, every time you're up close for more than 15 minutes with someone, especially if you have to remove your mask, you're sharing your risk with them, and they are sharing their risk with you. That means eating, drinking, having a coffee. And the amount of risk isn't fixed. It's dependent upon how many contacts the other person brings to the table and you bring to the table. Right now, each of you had a bunch of close contacts with your family, your friends at home, maybe ex-coworkers, or even unintended close contacts during your travel. We want you to start making new friends here, and we also want you to do so with less risk on your plate. The good news is that time is your friend. After a week or 2 weeks, your previous risk kind of times out. Basically, you have a rolling 10-day risk balance that you share with your other close contacts. And the stay-at-home order cleans that slate. There's another thing to keep in mind here going forward, though. Even after the stay-at-home order, you have to be careful about how many close contacts you have. You've all heard about gathering limits. That's not what we're talking about here. Gathering limits all assume that you're wearing masks and keeping distance because no intervention is perfect. You've heard me say this before. Your list of maskless close contacts, should you choose to have them, should be really short. You want to create a quarantine family type of a situation on campus, similar to what you had at home during lockdown, except instead of not being around anyone else, you just have to keep the other people distanced and wearing masks. Your up close and unmasked contacts need to be around 3 to 5 total in order for us to be able to keep in-person classes going. I mean it. If so many people are having more than 5 close contacts, infection may spread faster than we can manage. You need to aim for 5 or less close contacts on a rolling 10-day period. That's not to say 5 on Monday morning, 5 on Tuesday afternoon. It's 3 to 5 total over 10 days. It may feel restrictive, but it's going to be okay. I believe in you. I know you're creative and smart, and you can figure this out. We all believe that you'll figure out a way to navigate this challenging situation. That's why you're here. I hope this helps make some sense of the rules. Actually, I don't even want you to think of them as rules. I mean, you do have to follow them, of course, but I think it would be easier if you tried to internalize them as new normal behaviors. Behaviors that are as normal as wearing pants and not shouting out randomly in the middle of a class. Masks, distance, avoiding crowds, limiting contact. These are just things we do now to facilitate being able to be in a group setting like a campus in the middle of a pandemic. They aren't overly restrictive. They're just what we have to do. So help each other out. It's going to be hard to develop these behaviors, and we need to hold each other accountable in a very supportive and caring and maybe even lighthearted way, because we are all in this together.